So good morning, everyone. It's Eileen. If you can hear me, I hope you can, and welcome and thank you for joining us today. My name is Eileen Bird. I'm the Executive Director here at 2Life, and with us we have other members of our staff, including Melanie McCulley, Christine Brenton, and we actually will have Mara Ginsberg, our President and Founder. And so I want to just say a couple things and welcome, and then we're going to get right to our program and introduce Dr. Finn. So welcome to the continuation of our 2020 Women's Health Conference, Informed, Engaged Treatment, and Empowered Survivorship. If you can hear my voice, then you have successfully joined on. And please rest assured that you will not be viewed or you have been put into mute mode for the presentation, although we'll get to questions and I'll cover that in just a moment. And so today's talk is going to be delivered by Dr. Bridget Finn, and we're delighted to have her. And in conversation, she's going to be welcoming questions throughout the morning so that we will hopefully have I think a very lively discussion. Our program is offered in part by sponsors, and we have a number of sponsors. I wanted to say thank you to the New York State Department of Health, to Amona Corporation, Genentech, and to Saratoga Hospital. These sponsors are really the lifeblood of the support for our programs, and we're really happy to have you along. So let's get right to it. Breast cancer treatment can often have an impact on your body, on your outward appearance, on your senses, and your perception of yourself and the world around you. How you feel makes such a difference in terms of pushing yourself forward and getting yourself back together after you've had a diagnosis. And so I'd like to invite Mara Ginsberg, who's the president and founder of 2Life, to talk a little bit about body image and our subject this morning. Mara, are you there?
I'm here. So I share in thanking our sponsors and of course in thanking Dr. Finn for joining us today. This is very important, and it's our second in our series of 6 Women's Health and Wellness Conference Zoom calls. We usually do this as a one-day program, and I see on the attendee list some names of people I can't see, but I know you're there. So people that come every year to our conference. So welcome this way. I'm sorry I can't actually see you, but at some point in the future, we'll all be together again. And so with that, and thank you to 2Life staff for making this happen. It's always a challenge with technology, but here we are. Can you hear me, or am I frozen? I guess we're okay. So I today am
Okay, so we're hoping to get Mara back. Like with anything that happens in this world, technical difficulties do kind of dog us here and there. And so as soon as we can get Mara's connection back, we will hear a little bit more from Mara. And so I think that she is going to be signing in. And so I will let her come back in. But right now, I think I'm going to take this moment and give you a little background on our speaker today. And so Bridget Finn, who's the president and founder of the Capital Region Center for Sexual Health, has over 30 years of experience as a sexual health expert, a sex therapist, educator, researcher, and author. She has a master's degree in health education from Russell Sage College and a doctorate degree in human sexuality from the University of Pennsylvania. She completed her advanced clinical training and certification in sex and relationship therapy at the Council for Relationships, accredited by the American Association for Marriage and Family Therapy. Dr. Finn is a guest lecturer at Albany Medical College in the departments of behavioral psychiatry, urology, obstetrics and gynecology, and family and community medicine. And just before we welcome Dr. Finn, I believe that Mara is back.
I am.
So Mara, if you want to continue on, we get a frozen screen. So take it away.
I don't know what's up with my computer, so I'm on my iPad. So I just want to say that we've done programs on sexuality post breast cancer diagnosis and treatment over the years, several different times, and we usually have a robust discussion and hope that everybody finds this helpful. I will point out that you know, body image is just sort of woven into our culture, and breast cancer has different psychological impacts on people, and how you choose to approach your treatment based on body image, or how the body image affects you psychologically after your treatment is quite individual. And there's no right and there's no wrong answer for how you make decisions. But the objective today is for everybody to hear some advice on how you can be pleased with yourself after treatment, make peace with yourself after treatment, live robustly after treatment, no pun there. So, you know, whatever you need, we want you to get from this and learn tools and understand that you've made decisions that work for you, and don't let other people tell you what you should or shouldn't do. Whether, you know, I had a mastectomy and then I had another one. That was my decision with my healthcare providers as to what was best for me. And I personally chose reconstruction for a variety of reasons. And many people choose to approach things very differently. So, and then how that impacts your body image is, again, quite personal. So without further ado, and we can talk about sexual health, etc. Of course, after treatment, it's not just about breast and reconstruction. It's about menopause and symptoms that come as a result of that impact our lives as we go forward. And some of us started the journey as young people, so menopause hit us earlier, and some of the menopausal related changes in life hit us younger than they would if we had gone through the process, you know, of menopause more naturally, if you will. So there we have it. And thank you again very much. And I'm going to mute my iPad and wait to hear from Eileen, who will introduce Dr. Finn.
Okay, thank you, Mara. And that was helpful guidance as we start to move into our talk. So just a couple of pointers for everyone who's in the audience. And I see the numbers jumping up in terms of how many people have joined us and are with us. And so as we go through our talk, and we've got roughly an hour's worth of time, Dr. Finn is going to be monitoring the questions that come in, and I will invite you all to, and if you're not familiar with using Zoom, to click on, there's a chat box, sort of a little bubble down towards the bottom of your screen. If you click that box, you will see towards the bottom of the box that you have the option to send to either all the participants and the panelists, and then, or just to the panelists. And so you can direct your question appropriately. Dr. Finn will see any questions that come into panelists. And so as we go along, she may interrupt her talk to answer a question or two as it comes along, or she'll wait to the end of her remarks. But we want to make this certainly interactive and address any question. And as Mara invited, you know, this is a very personal journey, so that we want to be sure that the things that people have had lurking in their minds are put to rest today. So with that, Dr. Finn, I'm going to turn it over to you. Good morning and welcome.
Good morning. Thank you so much. I'm honored to be here. So I am honored to be here. I love having the opportunity to sort of get out of my clinical therapy space and work with a group of people. I'm sort of looking at a screen. It's hard because I can't see people, so bear with me. And I understand, Mara, that gremlins do get into our computers from time to time for no apparent reason. So here's hoping this goes well. So as Dr. Bird said, I am a sex therapist. I have a private sex therapy practice in downtown Troy, actually. And I also, pre-pandemic, have been doing virtual therapy for quite some time. So I do work with clients across the US as well as in person. One thing to know, in my downtown Troy office, we do meet in person with proper disinfecting, distancing, healthcare protocols and all of that. And it's been working out wonderfully. So I'm somebody that is on the front lines with people who are looking for an opportunity to talk about sex and intimacy in their lives. And I work with individuals, I work with couples, I work with any adult who's having any challenges or questions or concerns around intimacy, sexuality, and sex. And I've been doing this for about 35 years. So I get the benefit of knowing what is really concerning people and what questions are. It's very hard to know because we don't talk about this stuff. So we think we know what the information is. We think we have an idea of what other people are doing, but we really don't, because it is so private, and there's many reasons why it's not openly discussed or encouraged to be discussed. So people often say to me, what impacts intimacy? And by intimacy, we mean physical intimacy, emotional intimacy, spiritual intimacy, and what impacts intimacy and sexuality and sex? And my answer is everything. Life, right? Family dynamics, career issues, financial issues, relationship issues, and certainly a healthcare issue. So all of that can come together and create a perfect storm that can really get in the way and create some obstacles for people enjoying a full, pleasurable experience, whether they're coupled or single. Super important to back up and remind everyone that single people are sexual people too. So whether you're in a relationship, not in a relationship, whatever it may be, you are a sexual being. So, with breast cancer, the diagnosis and the treatment impacts directly a part of the body that we associate with sensuality, sexuality, femininity, womanhood. So there's a distinct and unique impact on sex and sexuality when it comes to breast cancer diagnosis and treatment. I want to say, though, that all of us really will have at one point or other in our lives, or at more points than others in our lives, a challenge to our sexuality because it changes. It changes. Sensations change, libido changes, appetite changes, relationship changes, and all of those things that I just mentioned, family, career, relationships, etc., they change. So most people at some point or another are going to be struggling with changes around, maybe parts of their body responding, or even feeling alive and available in a relationship this way. So because breast cancer does intimately impact a part of us that is associated with sensuality and sexuality, a woman is best served and best supported, if she wants, by having care given to her physically as well as psychosexually. And psychosexually means emotions and thoughts, behaviors, and relationship and spirituality. So when you combine that kind of support, you're giving a woman a better opportunity to pursue wellness on her own terms, okay? So the other thing too to keep in mind is that we don't show up to a cancer diagnosis as a blank slate sexually, okay? So we have shown up into this with a lifetime of experiences and messages we've received about sex and sexuality, behaviors. We have formed our values. We have heard things about sex and sexuality. So we're not coming in as a blank slate. So it's important to know that it's not always the case that someone shows up and everything was fantastic with regard to physical intimacy and sex and sexuality, and then suddenly because of the diagnosis, things have gotten really, really difficult. A lot of people struggle, and then you just add this onto it, and what it creates is a situation where we need to dig in and see how this new experience is going to sort of interact with all of what you've brought to the story already with your psychosexuality. So again, we are people who have already been shaped and affected by all kinds of experiences along the way. And sometimes it's kind of like if you think about an egg in a cake batter, it's sort of in there. It's sort of, you can't pick it out anymore. But it's a part of it. So the work in sex therapy is to provide a space, to hold space for you to come in and talk about the emotional journey, the relationship journey, the spiritual journey, and also to talk about and sort of unpack your psychosexual story and connect it to what you're dealing with now, okay? So, and Mara was absolutely spot on that, everyone's experience is different and it varies in terms of impact on feeling or sexual behaviors or arousal or even orgasm. So everyone's different, and where you may be at this point may change, again, to embrace the fluidity of the experience. So variation is key. The only thing, when people ask me what's normal, I say what's normal is variation and fluidity. So what I'm hoping is that every woman, everyone has the opportunity to consider if this is help that she could be supported with along the way. And what does that mean? It means acknowledging it. It means acknowledging that we're sexual people. It means acknowledging that sexual health is intimately woven into overall health and wellness. Okay, so I just want to back up and talk a little bit about, and I think it's important, sort of our broader culture. And because what this demands, right, when we go through this work, when we're trying to explore intimacy, sex and sexuality, it demands communication, okay? And that's super hard. And I think we need to link it to the broader cultural context in order to understand what makes it hard, okay? First of all, most of us had very little sex education, if any at all. And it was, for girls in particular, focused on prevention of either pregnancy or disease, or the plumbing. This is how reproduction works. This is what ovaries are, pregnancy, but rarely, if ever, on pleasure, certainly in my demographic, in being in my 50s. Now, younger kids these days, maybe there's a little more being spoken about, but not so much. I'll tell a quick little fun story. So when my son was in 6th grade, he was having his first sex education class. He's 16 now. And he said to me, I don't need to go, Mom. I don't, I said, you're going to go and you're going to see and be a part of it. And he came home that day and he said, the boys got to go out to recess a lot quicker than the girls. I think the girls must have a lot more they need to know about sex. I was like, okay. So, what did he come home with? He came home with some deodorant, right? What did the girls come home with? They came home with a tampon. So when I was a kid, we came home with a Stay Free Maxi Pad. Now, we haven't really evolved very much in terms of what we're talking about, if we're talking about it. And we are very schizophrenic with our with sex and sexuality in our culture. We hear it's good and we hear it's beautiful. We also hear it's dirty. We also hear it's wrong. We hear that it's spiritual, but we also hear that it's shameful. We hear sex is dirty, so save it for the one you love, which is what? That's, you know, the hypocrisy, the fear, the shame around experiencing pleasure, around apprehending sex and intimacy. So, you know, there's our context, the framework within which all of this is experienced and considered is quite dysfunctional. All right. So we have that piece. We also have the layer that women's sexuality in particular is judged like no other. So, you know, when you think about if you've gone to the doctor, could be a regular, you know, physical checkup, very rarely is anyone asking about pleasure. They might ask, are you having, you know, any pain? If they ask about your sexual health at all. But no one's talking about pleasure. Are you experiencing pleasure? Do you know how to masturbate and pleasure if that's something that you want to? Are we giving women permission for that? Okay, so we have a situation where we're not really given permission for it, because you can tell as much about a culture, about a society, by what's being spoken of, or as much about a society by what's not being mentioned as we can by what is being mentioned. So women's sexual pleasure is not something that we talk about. And if we do, we feel embarrassed or ashamed. We're not sure we have permission. So first step always in this work is to give yourself permission for pleasure. And what does all of that mean, right? So those are the questions that we would be you know, sort of exploring in any kind of therapy work. Do you have permission to experience pleasure, to explore what that means to you? And, you know, to give yourselves a break. It's hard to talk about this stuff because of what I just said. So what does that lead to? Lack of confidence. We don't have the language that feels right to talk about it. We just kind of feel stuck. And so between those two things, we can kind of get into a situation of, well, I feel like this is important to me, but should I feel like this is important to me? And am I going to feel foolish if I think this is important to me? So there's all of those things that sort of come together as a perfect storm to make this stuff, you know, super difficult for some people. Typically, the people who come to me, women who come to me, who are dealing with a breast cancer diagnosis and treatment, are coming to me. They were referred to me by their physician, or maybe a friend or an advocate, and they come to me because they have concerns about physical sensation, in particular, maybe on the nipples, or there's pain with intercourse due to treatment or medication, or there is an appetite issue. Suddenly, I just don't feel like it. Well, you know, when you think about it, if you're fatigued and you're stressed, the amygdala, fear center of the brain, is not really going to open up enough for you to feel like you can experience pleasure. So what do we want to do? We want to set the stage. We have to set the stage. And what does that mean? We're going to look at mind, body, spirit. We're going to talk about all of those things in your life, your family, career, finances, any kind of dynamics with friends, so your environment, your home situation, any kind of trauma that you might be bringing into the conversation. We want to set the stage to alleviate some anxiety, to help you with fatigue and stress and fear as much as we possibly can, so that if you do decide that you would like to you know, see what's possible with sex and intimacy, you're set up much better, right? So it's kind of like the farmers with the field, right? They till and they prepare and they get it all ready so that what we're looking for can ultimately manifest. So, you know, again, tying it right back to what impacts my interest, my arousal, my sensation, the answer is all of that stuff. So we would be looking at all of those pieces, which is good news, because that means there's a lot of places for us to look at in your life and influence and impact that could perhaps get you closer to what it is that you would like to experience. For relationships, for people who are in relationships, it's interesting. Women will come to me feeling bad I would say is the word, that they, are unable just not there to feel like they can experience sex and intimacy with their partner. And they worry about their partner's feelings and about their partner's needs not getting met. It's not unusual for a woman's focus to be external on her partner and the needs of the partner. What I will say is that the hundreds and hundreds of partners I've met along the way are hugely supportive and not at all focused on their own needs. But that is a main concern of women, is my relationship, and I'm afraid it's going to suffer. A single woman, for example, might come in and feel afraid of, how do I date again? How do I have this conversation with someone that this was my experience, or that this is kind of, where I'm at with my body. This is where I'm at in this journey. It's very, very vulnerable. So for single women, it's, how do I give myself permission to get into a relationship? And for women who are in relationships, it's, how can I be present in a way where my partner isn't feeling, left out or disregarded. So, there's all of those concerns. The other thing too is, because nobody's coming into this as a blank slate sexually, and in relationships, you and your partner have a history of communication dynamics and relationship dynamics, and a way that your sex and intimacy is experienced in your relationship. And it may not have been great before the diagnosis, right? And this might feel like it's just one more thing that is sort of shining a spotlight on some of the issues in the relationship with regard to sex and intimacy that aren't fulfilling you or inspiring you or need your attention. So there is that piece of it. There's also a possibility with the work that we do where individuals and couples can come out of this with regard to their sexuality after doing all of this exploration, after connecting their story to their current experiences and journey, where they come out of this even better and stronger and more confident with regard to their body, with regard to sexuality. Because what happens? We have to flex muscles that maybe we weren't flexing. Number one being, once again, the communication muscles. This happens with couples anyway, who, say, for example, people have been together years, everything's been going along, with sex and intimacy in a way that has felt good enough for people. And then something happens, whether it be grief or loss or illness, all of those things, where what is demanded is that this couple has to now figure out a way to experience pleasure and intimacy in ways that they had never had to consider before. And it can feel difficult and it can feel awkward, and we don't always know what to do and what does that all mean. So, these are challenges that impact every part of intimacy and sexuality, but not necessarily in a bad way by any means. So, there's all of that kind of stuff. So, what does this all mean? So in terms of two of the big things that we talk about is, what meanings are you placing on different things? For example, what have you decided that this now means about you as a woman? What have you decided that this now means about you as a couple or as a single person? What have you decided that this means about you, that you are unable to orgasm in the way that you would like or that you're used to? What does it mean about you that you're having trouble getting aroused, or that your appetite for intimacy might not be what you'd like it to be, right? So, and why do I talk about this? Because the meanings that we attach to things, right, are attachments, whether that be to meanings or other things, can be our greatest barriers and our biggest forms of suffering. We decide that this means that I am, maybe a woman decides I'm inadequate, I'm less than a woman. I am unattractive. I am not sexy. No one's going to want me. This means my relationship is over. This means I'll never date again. This means I'm broken. Okay. So the meanings that you're attaching to the various parts and elements of your journey with regard to sex and intimacy are places that we really want to dig in and make sure that we can reframe that for you and find meanings that aren't there to feel negative and judgmental. I mean, if there's anything that we do with sex and intimacy is that we judge it, and we can be very negative about what it all means. Look, if a guy is having trouble with an erection, getting erection, keeping erection, erectile dysfunction, that is intimately woven into his feelings of being a man and what all of that means. Okay, so your meanings, we want to be careful of those, of what you're attaching to that, and what are your expectations, really. Super important to understand that. What are your expectations of yourself during this time? What are your expectations around your feelings and around your body and around your relationship, right? So we're gonna look at all of those things. And basically, you know, we live in a society where sex is defined as penile vaginal intercourse, pretty much. If you ask, you know, any person on the street, that's really what they're going to say. So when the vagina is hurting or is not responding the way we would like and the way we might be used to or wish it would, we are at a loss for how can I experience pleasure in a way that still feels like enough, where it's maintaining connection, where I'm getting joy from that. And again, we also want to encourage self-pleasuring, because when there is self-pleasuring with, you know, vibrator, hand, whatever it might be, or if you have a partner, bringing the blood flow to the vaginal tissues is super important. Okay, but again, give yourself a break. You know, maybe you're not there yet or want to be there, but the idea that the only way that we can experience physical, sexual, sensual pleasure is with, penile vaginal intercourse, gets us in trouble, right? Because what if the penis isn't responding? What if there's erectile dysfunction? Again, what if the vagina is not responding the way we want? We feel lost, we feel broken, because that's the only way we have come to really conceptualize pleasure. And if it's anything different than that, okay, if it means expanding variety of touch, variety of behavior, expanding your sexual repertoire to move past just focusing on vagina or parts of the body that at this particular point in time might not be comfortable for you. So we need to expand our idea of what intimacy even is and what pleasure even is. And that's the good news, right? Because you get to sort of have fun with recognizing that we are sensual beings from head to toe. But here you can see where you might get jammed up if you're in a relationship where that demands communication. Like suddenly now we have to talk about this whole other way of being with each other when we never have. And, we don't even know what that means. And we also have a hierarchy when it comes to sex and intimacy. So penile vaginal penetration is what we're, shooting for. I'm sure you've all, done the bases, right? First base, second base, third base. I'm Irish Catholic, so it was 3.5, 3 3/4, then fourth base. But it's a very linear model, and it's all about reaching that precious, ringing the bell for hitting a home run. And if it doesn't go that way, we've decided that there's something wrong with us, with it. It doesn't count as much, okay? We see this a lot around orgasm. Somebody might have trouble orgasming. Sometimes an orgasm is more of a whimper than a bang. So, it's again, the judgments we're placing on it, the meanings we're placing on it. Oh my gosh, what's wrong with me? My orgasm wasn't as strong as it was, a month ago. I must be therefore, broken, less of a woman, a disappointment. So again, meanings and expectations we want to keep in check. But make no mistake about it, this stuff has a tendency to filter in to all of our parts of our lives. But again, I want you to be positive about that, because that means we have more places that we can look at and that we can impact and we can inspire in you. So, again, in terms of grief, I want to talk about. Grief is a big zapper of interest, of arousal, and we need to honor that. Okay, so again, I want to encourage you to honor your journey where you are at. There is no expectation except the one that you're placing on yourself to feel like you have to embrace all of this sexuality, physical intimacy, behaviors and whatnot. You can do what you want when you want. It's about embracing the fluidity, the change in experience. And we're going to also talk about expanding your repertoire. I mean, what is sex to you and to your partner? What does that mean at this point, in your life? And what was it before you arrived at the breast cancer diagnosis and treatment? So it's about letting go of our expectations. It's about challenging our meanings. It's about expanding our repertoire, expanding our understanding and perspective of what sex even is, of what intimacy even is. And for women, I'm just going to put it out there. For women, we need to be inspired to want to. Okay, so for a guy, I wrote a book, actually. I'll tell you a funny quick story. The name of my book is Inspired Vagina, Capable Penis, right? So a woman wants to feel like it. A guy wants to be able to. And just a little side note, the title of that book actually got me harassed and vandalized, and I lost my office, and the cops had to be involved because there was a couple of people who were hugely upset just by the title. Back in the day, it would have been a banned book, right? So this is what I want to really hit home. This stuff, do we have permission to talk about it? Do we not have permission to talk about it? Is it beautiful? Is it shameful? Is it dirty? Is it lovely? I mean, which is it? Right. So the discourse is just inherently dysfunctional. So there's all of this swirling around. Okay. And what do I say to providers? Okay. Medical providers who I work closely with, who recommend to their patients that they do come on over to me and have a space, hold a space for you to have these conversations. What I say to them, and people want to say, that women say to me, how do I talk to my doctor? We know that patients want to be able to talk to their doctor. We know that doctors want patients to be able to talk to them, but sometimes that just doesn't happen. Some of the reasons, patients feel like they're going to be judged. My goodness, I'm fighting cancer. I'm in this. Why am I in here talking about this silly little thing called pleasure? Okay, so again, that ties back into permission. But I always want to encourage physicians. They talk about they're short on time. It can be tough in a visit to cover everything. And there's also a fear of what if I'm asked a question that I'm not sure of the answer. So even little things like making sure in your waiting room that you have something that says the word sex on it, something that communicates to patients that you are open to having this conversation. Online patient portals are a fantastic place to put information. We want to be sure everything is language inclusive for LGBTQ community, making sure that everyone feels like they are seen and given permission to bring up the conversation about sex and intimacy. So if there, and one physician I work with closely actually let me know that he did put some information in his waiting room, a couple of magazines, whatever it was. And he was just so excited to know that people actually started talking about this a little bit more. So we know it's important. We're all a product of society, so it makes it difficult. And ultimately for you, it's about what is the value that I place on sex and intimacy in my life, right? Everyone's different. Some women find it super important. They see it as intimately tied into their overall joy, into their overall inspiration, their overall health. It's important in their relationship or if they're single. And in that case, it's important that you partner with someone for whom the value is shared. Then there's other people, maybe not so much, then that's cool too. There is no judgment. So it depends upon how it's impacting you, the meanings, the expectations, what value you place on this, and ultimately what kind of sexuality, what kind of pleasure, what kind of experience do you want to create for yourself. So this is not, again, I really want to stress that it can be a super positive experience because it's going to demand something from you that likely wasn't demanded of you before in terms of perception, behavior, expansion, letting go, relationship dynamics and communication. So we flex those muscles and you would be surprised the joy that can come out on the other end of it if you'd like and when you're ready. But again, it's on your terms. I did get a question. I don't know where it went, and I'm terrified to touch any button because I'm sure that I'll lose everyone if I do. So maybe that could come up again. I don't know. If anyone has a question at this point, I would love for you to feel like you can ask it. I'm somebody who's pretty laid back and informal, and I like to kind of think of things just more of a chat. So I apologize, I lost that question that came up earlier. So
Dr. Finn?
Yes.
I'm sorry to cut in. This is Melanie. I can see the question. I'm going to read it to you if that's okay.
That's perfect.
It says, what do you suggest if a woman misses sexual intercourse with her male partner, but is experiencing severe vaginal dryness and atrophy from breast cancer related medication that she may need to take for 5 to 10 years?
Okay. First to whoever asked that question, thank you. And I'm glad that you're here. And what I'm glad to hear, because I'm always listening for different things, is that you miss it and that it's important to you and that you want to figure out a way that you can enjoy this again with your partner. Now, I recently went to a breast cancer conference I was also a speaker at, and there was some information and honestly, your medical doctors are super sources of information. One person from Sloan Kettering talked about research that came out about like a Replens, which is a moisturizer, different than a lubricant. A moisturizer is something that we use more. A lubricant is sort of, I'm going to have sex now, I'll use a lubricant, but a moisturizer is sort of an ongoing treatment. And when they put the moisturizer at the entrance of the vagina, or around the entrance of the vagina, the Replens, you can buy it right over the counter at Hannaford. In the research studies, it showed that there was blood being drawn to vaginal tissues. Now, I'll be honest with you. I have not met many women who come into me and say, oh yeah, that made all the difference in the world. Because remember, there's a lot of things impacting this. So it's one thing you could try. Also, pelvic physical therapy is available. A lot of people don't even know it's a thing. These are physical therapists who they do their physical therapy. It's pelvic health. So what they will do is help with any muscular structure in the vagina, around the abdominal muscles, the gluteus muscles. Women hold stress in that area. So Albany Med has a great program. Memorial has a great program. Saratoga has a great program. These are physical therapists. I love them all. These are amazing women who work with women to help them identify triggers and muscle knots and anything internally that can help them have a more relaxed, pleasurable experience. And they will teach you as well about your body and when your muscles are spasming. So, if your muscles are spasming from fear or pain, you know, pelvic physical therapy might be something that could be super helpful for you. In the meantime, this is going to demand some conversation with your partner. This is where I mentioned expanding repertoire, finding out what is possible for us, what can work. Don't leave the spotlight too long on what's not working, and how can we give each other joy and pleasure while we're working through some of the challenges with the vaginal tissues and discomfort. I hope that helps. There was another question that disappeared. Melanie?
Dr. Finn, it's Eileen. I think I can
Okay.
help with the next question.
Okay.
Okay, so here we go. My husband is no longer attracted to my body since I got sick. It has changed a lot. We are very close, and I'm not sure how to help us.
Yeah, well, again, what could be happening too, and this is something that we don't often associate. When there's a male partner, he does not want to cause pain, and he may be, like in this question, not feeling attracted to your body. In that case, he may end up experiencing some erectile issues himself. But again, in that case, I think we want to look at expectations around women's bodies. How can we redefine what is sexy and attractive, and how his perception of your body at this point is playing on you, on your mind, on your psyche, on your spirit. And so we would have to sort of challenge the narrative about what it is to be sexy, to look sexy, and do some couples work there to see what is possible, and what is getting in the way, and what can inspire differently. And also, we want to talk about how you feel about your body. If you think you're sexy, if you feel sexy. So I think the broader discourse of what it means to be sexy and vibrant would be discussed there, and to see what's possible within that marriage moving forward. Is there any other questions? At this point?
So you got a big thank you, Dr. Finn, from that last response. So I think that certainly
You're
hit a
very
nerve
welcome.
in terms of, I think you brought up a topic there about the relationship dynamic. And as you were speaking, I guess the piece that was going through my mind was how difficult sometimes it can be to communicate with someone that you've been very close to for a long time, and you've related to. Your relationship goes into grooves, particularly when you have close and good and confident relationships.
Yeah.
And so as we go into this next phase that says, I'm the same person, but not quite the same. You know, there's some differences, and a lot of, of changes have been made from a physical state, which affects that mind-body relationship. And where are we going with our relationship going forward? Can we navigate to a new place, a better place?
That's correct. That's correct. And, really digging into some of those relationship dynamics that maybe haven't been given enough attention to in the past, and flexing muscles in that relationship that you haven't had to, creating a sense of safety to be vulnerable in this new conversation. And again, being open to what is possible, and creating, again, think of it as this is an active, intentional, participatory process that you are in charge of. It means unpacking a lot of things to see what's possible, but also honoring your pace, honoring where you're at.
Dr. Finn, there is a question that came in. How would you factor in alcohol to dynamic?
Let's see. Well, too much is never enough, right? And again, I want to emphasize that you will be working with a medical staff and medical people along the way too, who will also be talking with you about these questions. I'm not sure what you mean in terms of alcohol, how it plays in really. If it's in terms of lessening pain, I'm not sure. I would need a little more on that.
So I don't have more on that, but I do have another question that I want to jump to, because it might be a little bit more vague on the alcohol. Maybe we can come back to it. So you had so this is a question that comes from another facilitator. You had spoken at a support group. You have a member in her early 40s, or the support group has a member in her early 40s who mentioned not easily that her and her husband do not have sex due to pain and dryness. So she was the one person who I wanted to be here, but she didn't show.
Okay.
She thinks sex is over for her and her spouse. How do I encourage her to explore these methods that may help her?
Okay, so again, to encourage her to explore requires giving permission, talking about what might be getting in the way of someone giving themselves permission to apprehend sexual pleasure in their lives. To explore, again, the expansion of the atrophy and the painful intercourse at this particular point is real. So therefore, what can we do outside of penile vaginal pleasure to enjoy other ways of experiencing pleasure, orgasm, connection? Again, it does demand a certain amount of letting go of what's not possible at this particular point in time. Things change over time. I'm not sure how that will end up for this particular woman in terms of her body, but it does demand, I'll give you an example. I work with a lot of military veterans who have had injuries or life-altering surgeries, who are unable to make love in the quote, right way, meaning penile vaginal. And part of that journey is grieving what's not possible, and recognizing that being a good lover, good intimacy goes way beyond the hard penis or the functioning vagina. We need to honor it and give it its space to heal and see how it can change. But at the same time, what's necessary is to continue bringing in joy and pleasure as you move along through this journey. I can't say how something will end up for someone in terms of level of pain. Again, I do want to encourage at least looking into pelvic health physical therapy for some work internally in the vagina and those muscles. But at this point, a couple sitting down and saying, okay, what can we do to maintain this connection and this closeness that is absolutely imperative as we move forward in our relationship. The baby can't go out with the bathwater. We have to maintain some kind of presence. How are we participating in this now in light of this new information? It's about being creative, and it's about being open.
Thank you, Dr. Finn. And
Sure.
actually, I'm going to read the next question, if I may.
Sure.
So we're going to shift gears a little. As a single woman, when and how do I talk about my mastectomy? And then skittishness about now being intimate when I begin dating again. Can you offer some guidance?
Sure. Yeah. We definitely want to have any kind of vulnerable conversation with our clothes on. Okay. That means that, having these conversations in a contextual setting that is not leaving us feeling more vulnerable than we already are. So that typically means clothes on, not in the bedroom or in a place that's associated with sex and intimacy. And also, I always encourage to start conversations more in a broader context, more of an existential discussion of sex and intimacy. What do you think about sex and intimacy? How important is it in a relationship with you? What experiences that? So we start to go down. We start broad. What do you think? What do you know? Into more vulnerable discussions of what do you do? What do you need? But here's the other thing. I want to remind people that these conversations, that level of vulnerability needs to be earned by somebody. Okay, so if you're dating someone or thinking about dating someone, they need to earn that vulnerability. We don't go out and just share everything, the most vulnerable things about ourselves from the get-go. They have to show that they have earned that conversation with you. So here's what I want you to remember. When they have earned that with you, that idea of having a conversation isn't going to feel as scary as it does right now without having that piece of it already connected in the puzzle. So not with your clothes off, away from a vulnerable context like a bedroom, making sure that person has earned your privacy and earned your vulnerability. And then that conversation takes on a very different energy.
Thank you, Dr. Finn.
Mm-hmm.
I now have a question. As a husband of a mastectomy survivor who was not able to do reconstruction, how do I get beyond what my wife now looks like?
Well, that's an honest question, and a lot of what would be pertinent in that is I'd want to know how she feels about how she looks, because the way she feels and how she's experiencing her body and how she's processing her body is energy that is going to flow into your perception as the husband. So, in other words, if someone gets to a place of recognizing her beauty and her goddessness in all of those changes, and gets to a place of embracing and feeling positive, that energy flowing from her is going to go to him. And also, again, providing space for him or as a partner, as a husband, to sit and safely talk about, hey, I'm being challenged by this. I'm not sure what to feel about it. I might not feel so good about the fact that I'm having trouble being attracted. And so again, space for the partner to process some of those feelings. But we want to make sure we're building up in her idea of her body so that that energy is flowing in that system between him and her. But challenging again, it's not easy being a woman. I don't care. I've met thousands of women, all situations, shapes, sizes, and everything else. And I've never met one that said, yeah, I'm hot. I feel great. I love my body and all of my cellulite and everything else. So we have to start challenging that narrative about what that means to be sexy from a man's perspective and a woman's perspective.
So those are probably really, really great comments to start to close up on, since being respectful on time, we are coming up on that 10 o'clock mark. And so Dr. Finn, and actually I'm going to turn on my video for a second as we kind of wrap up. And so I think you brought up some really great points, and I want to thank everyone in the audience for asking some, I think, very raw and very real questions. And I think that helped to frame some of the remarks that you had originally started with, Dr. Finn. And so as we kind of start our wrap-up process, what I'd like to do is invite Melanie to give us a bit of a wrap-up and talk about the series. In another time and place, as we talked about communication today, we would all be live and be in the same room. And I think we kind of feel a little different dynamic, and it has been incumbent on each of us to type in our questions to, kind of get the juices flowing, if you will. So I appreciate that. Melanie.
Thank you, Eileen. Good morning, everyone. On behalf of 2 Life, our board of directors and our education advisory board, thank you again, Dr. Finn, and all attendees. Today's program was the second in our 6-session Women's Health Conference, which continues on Wednesday, December 2nd at 2 p.m. with Dr. Heather Stahura from Capital Cardiology Associates. Dr. Stahura will speak about cardiac health in relation to breast cancer and treatment. The 4th program in the series is about breast cancer treatment and bone health. That's on December 17th at 9 a.m. with Dr. Mary Pat Roy. She's from the VA Medical Center. And Dr. Jennifer Bremser of SUNY Plattsburgh will speak on the topic of cognitive health and breast cancer treatment on January 12th at 9 a.m. And then our program will wrap up with Dr. Kahn of St. Peter's Partners, and he'll speak about metastatic and complex diagnoses on January 26th at 9 a.m. So there's still time to register for programs if you have not registered for all of them and would like to, or you know somebody who wishes to, there's still time to do that. In addition to this conference, 2 Life continues our regular programming, and on November 17th at 7 p.m., Dr. Jose Barba, who's from St. Mary's in Amsterdam and formerly Mount Sinai Hospital, will be speaking again on a virtual program, Demystifying Radiology, or Radiation Therapy, I should say, and he'll be answering questions from patients and survivors, and there will be Spanish translation for that program. So the virtual event is free, as is this conference, but registration is required. So just reach out to me and I'll get you connected for that program. And 2 Life support services and our boutiques have continued despite our COVID challenges. Individual and group support are offered via phone and virtual meeting platforms, and our wig and mastectomy boutiques are continuing to provide services by appointment and using proper safety precautions and screenings. So shortly, you will receive an online evaluation, and we really value your feedback. We got great feedback from our first program, and we appreciate that, as what you have to say about what we're offering informs our future programming. So we really appreciate it if you will complete that brief evaluation and let us know what you think. And we hope you're enjoying this 6-part women's conference. Those circumstances call for us to provide it virtually this year. We remain committed to providing the caliber and quality of education that 2 Life is known for as a trusted community health resource, empowering women with impartial information based in evidence and research. So have a great rest of your day. Thank you again, Dr. Finn, and all who made this program possible, including each of you for attending and for your continued support of 2 Life. We really, really appreciate it. Thank you.
Thank you.
Have a great day, everyone. Thanks for joining. Talk to you
Thank you.
next time around.